Alright, today for my pre-hospital assessment OSCE 1 video we are attending a 68-year-old lady named Mabel. She is called the ambulance today because she has gotten up to pee during the night and had a sudden onset of chest pain radiating to her left shoulder. Mabel constantly goes to the bathroom during the night because she has a history of UTIs, and so through that she has been told to drink a lot of water and is on antibiotics. When I am going to approach Mabel, what I'm going to be looking for with chest pain is her appearance, with how she is perfusing, any swelling, how she is positioning herself, any cyanosis in the peripheral or central cyanosis that we can see, and just those initial checks on what I can see with her A, B, C, her GCS, how orientated she looks. And just my initial assessment on where we go from there. I'm going to do a cardiac assessment from there. Just with anyone with chest pain, they are going to go to hospital, so we already know that. So we are just trying to differentiate whether it's a medical emergency that is time critical, or if we can take our time with this and do a thorough assessment for ED. So just doing my initial scene assessment now as I approach. Hello, ambulance.
Hey, come on in.
Hi there, no obvious dangers that I can see. Hi, what's your name?
I'm Mabel.
Mabel, hi, I'm Fletcher.
Hi, Fletcher, nice to
Hi,
meet you.
just going to do a quick feel of your radial pulse there. What's happened today?
Oh, I was just getting up to go to the bathroom and I just suddenly got up with a chest pain.
Oh really? Has this ever happened before?
Not the chest pain, no. Pretty weird.
So it's just in your chest.
Yeah,
Can you describe it for me?
Well, it's here, but it's kind of going down my arm as well a little bit. So.
At this point I just asked my offsider to do a full set of vitals, just get the blood pressure, doing heart rate, SpO2, and then we'll move on to get a 12 lead with chest pain on this lady. So you don't have any cardiac history?
Well, I don't have any cardiac history, but in my family there's been quite a few people who've had heart attacks in the past.
Oh,
so.
really? Okay. And so you're describing the pain as moving to your left shoulder.
Yeah.
Is there anything you can do to help the pain, or your positioning, anything like
I
that?
mean, I'm kind of comfortable right now, but nothing going except.
Right. So you got up to go to the bathroom. And were you exerting yourself, going upstairs or anything like that?
No, just walking along the hallway.
Yeah, so it wasn't that hard for you and it just suddenly came on?
Yeah, no.
Oh, okay. On a scale of 0 being no pain at all and 10 being the worst pain in your life, what would you describe it as?
Around about a 7.
Around about a 7.
Not too bad, but it's definitely there.
Okay. Do you have any medical history?
I had my gallbladder removed a couple of years ago.
Right.
And I also, I had UTIs quite a lot. I don't know if that's got anything to do with it. But yeah.
Are you staying well hydrated?
Yep, lots of water.
Are you on any medication?
I am on some antibiotics for the UTIs, yeah.
Okay. And is that why you go to the bathroom quite a lot?
Yeah.
You're staying hydrated?
Yeah.
Okay, fair enough. So now we'll look at my vitals, seeing what we have presented with. So we can see that the patient is slightly hypotensive, 150 of 80. I was then just do a quick full assessment of the patient, so checking for any swelling, peripheral edema, central cyanosis, peripheral cyanosis, how well they're perfusing, the colour of their skin, the warmth, if it feels sweaty or clammy. And I can't see any of that presenting right now with the patient. 12 lead looks normal, with no abnormalities, and normal sinus rhythm. So really with the chest pain, we are going to transport the patient to the hospital. We'd have to get further blood tests and monitoring. But we'd also look into what the patient was saying with their abdominal disorders, so the UTI and having gallbladder removed. So at this point with the chest pain and the presenting of an MI, myocardial ischemia, and her mentioning that she had a gallbladder removed, that could point me in the direction of pancreatitis, knowing that people who have a cystectomy do have higher risk of developing pancreatitis, as well as a UTI could be cause of infection. So I'll just ask my officer to do a quick temperature, and then we'd move on to do an abdominal assessment once we are pretty comfortable that it's not cardiac related. As well as that, I'm looking at Dex triad for the patient as well. So I'm checking the percentage of your veins, muffled heart murmurs, sounds, and hypotension, which the patient doesn't have any with. Cool, so we'll go to abdominal assessment. So Mabel, what I'd like to do is just to check out your abdomen. Okay, because you're saying that you are having some pain there, is that correct?
There's a little bit of pain. I get it quite a lot though. But it's a little bit worse than it.
A little bit worse than normal, would you say?
Yeah.
Okay, what would you call the pain in your abdomen of 0 to 10?
Oh, it's about a 7 as well.
About a 7 as well.
It's normally 7 about a 5.
So I just would like to have a quick look and then feel of it. Is that alright? We just lie down flat. So at the moment I'm just looking for any swelling, any bruising, internal bleeding, if there's any fluid retention in it, or if there are any surgical scars. I can see there is one surgical scar. So maybe we'll just scar here just from when you had your gallbladder removed?
Yeah.
Okay.
Yeah.
Very good. Alright. So just getting a quick feel there, just feeling if I'm warmth, if pale or sweaty, and if there's any immediate pain from touch. Okay, could you just point where the pain is directly?
It's around about here, just this middle.
In the middle? Okay, so I'm just going to start furthest away from it and going in 9 quadrants. I'm just checking the patient from the grimace.
Yeah, it's a bit painful.
Painful here. Okay, I'm sorry. Just check. So we're looking at a central abdomen region where the urinary tract is, could be possibly a spread of UTI, but with the presentation of shoulder pain. So just continuing on from our abdominal assessment, I just want to have a quick listen into your stomach, okay, and just make sure that there's no blockages or absence of movement happening there, okay?
That sounds good.
Perfect. And then just make sure that there's no hardness around your organs or anything like that in terms of bleeding. I just want to do a palpation, okay? So what it's going to involve is just put my finger like that and just tap it out, okay? And was there a little bit of pain there?
There was a little bit down the bottom.
Well, I can tell you that it doesn't feel abnormal. It feels fully, soft, not any rigidity or hardness with that, and then the colour all looks normal. So with your slight temperature, with the shoulder pain and chest pain, that would be my primary diagnosis would be pancreatitis, acute pancreatitis. Presenting as an MI, which is common with the referred pain pathways. So Mabel, do you know what today is?
Yes, it's the 2nd of May.
Yeah.
3rd of May.
And what's your name and date of birth?
My name is Marvel Banks, and my birthday is the 21st of the 9th, 1953.
53. Okay. Very nice. Cool. So with looking at her red flags from abdo pain, we know that she has been in hospital with the chest pain, but we'd look at the abdo pain red flags, which are a severe pain on palpation, a temperature of 38 from our vitals. We have her being over the age of 65, the age of 68, and as well as that, the frequent urination is an orange flag. But it's not really relevant. They'll give us some pain relief on the way, and so yeah, we'll be consulting for that. Thank you very much, Mabel. We'll get a move on.
Thank you.
So I just want to discuss a couple of key points with our 68-year-old lady Mabel. One of them is just the tunnel vision that you can sometimes get from chest pain radiating to your left shoulder. You automatically want to go towards a cardiac issue, so myocardial ischemia, angina, all of these sort of coronary artery disease issues. So when I was looking at all the signs, I was trying to prove my diagnosis wrong, and I couldn't find anything except for the hypertension, and that's not really enough with the pain to call it a cardiac issue. So then you can take your time with it and then get a more thorough assessment. And then once I got the clue of it being having gallbladder removal, being more susceptible to pancreatitis, and then a severe acute pancreatitis presenting as an MI, and myocardial ischemia in the left arm, radiating into the left arm, then it starts to piece all together. So it's all about reassessing where you're at in terms of what the patient's given you, what vitals you've taken, and trying to make it all fit together. Another thing is just with the referred pain, looking at those dermatomes, knowing your anatomy and how that works and what presents as what. So if it was a severe UTI with polynephritis, you would expect aching upper shoulder back pain. So she did mention that she has UTIs, but with so you could also look at that, and it's quite difficult to definitively diagnose an abdominal abnormality, but yeah, that was just a classic sign of pancreatitis. Yeah, so thank you very much.